Welcome once again to the DKA channel. I'm your host, Nurse David, and thank you for joining us today. In today's episode, we are going to talk about the role of the nutritionist in care coordination. I think most times we talk about care coordinations and nutritionists are the least that sometimes we talk about. We usually think about what physical therapy, we think about social worker, we think about occupational therapy, but we often don't really talk about the nutritionist, right? And so today our focus is going to be about, talking about the role of the nutritionist in terms of care coordination. And I have amazing people here who are like nutritionists, like specialists. So tune in, stay tuned, and then we'll talk to them and then see what they have for us. I'm sure they're going to share some wonderful insights, into their role and in terms of promoting patients' health. So let's go on and then get to meet our guest. Yasmin is on my extreme left. And Yasmin, welcome to the DKA channel.
Hi.
Very happy to have you here today. And I would like you to tell us more about, yourself.
Yeah. My name is Yasmin. I am a clinical registered dietitian. I work at a hospital, one of the many hospitals here in Seattle. So my predominant role is to work in inpatient setting. So I see patients that are literally admitted to hospitals. You will not see me outside of that realm. And yeah, we'll kind of go more into details, I guess, later on about what we really do, what like the care coordination and kind of the details of like what my day-to-day looks like.
Yeah, definitely. And to my closer left here is Mariana. And so, Mariana, what about you? Tell us a little bit about yourself before we dive into today's topic.
Yeah, I'm Mariana. I'm an inpatient clinical dietitian in the greater Seattle area. I feel like we should have brought snacks. Like in the business of feeding people.
Oh.
We probably should have brought you food. I work all over the place in the hospital. I always tell my patients, they're like, oh, am I going to see you again? I'm like, I hope not, because if you do, you're probably really sick. So it's usually best to, get out of the hospital and get on with your life. But I work in all different areas and we can definitely get more into that. But definitely in the business of feeding people for sure. Yeah.
Yeah. So definitely we are going to get more into that, and what kind of feeding you guys feed people. If you say feeding, I want to understand what kind of feeding you guys do.
Mm-hmm.
But before then, right, you guys are nutritionists. Let me say it well. Is this correct? Clinical nutritionist.
We're actually clinical dietitians.
Clinical dietitians. Yes. Okay, yes. Clinical dietitians.
And we're dietitians, not nutritionists. So that's something confusing because even in our credentials, I believe it still says registered dietitian nutritionist. Right. But do you want to explain the difference between a nutritionist and a dietitian? We were just talking about this.
Yes,
a lot.
Yeah.
It does.
And I would be the first to admit to you guys that, hey, when I started, this conversation with them, I realized how little I knew about their role and the difference between dietitians and the nutritionists. And it was an eye opener. And I'm sure there are so many nursing staff out there that sometimes confuse these two roles, and they just open my mind, my eyes about, the fact that these two roles are completely different and what they do are maybe some integration somewhere, but also completely different roles. So thank you guys for coming and thank you for opening my eyes on that. But before we get into that detail part of it, I would like to know about, the influences or what influenced you guys into going into this career actually. So let's start from Yasmin. So Yasmin, what made you decide to become a nutritionist or a clinical dietitian? By the end of the day, by the end of this show, I think I'll get it.
Yes. Okay. If you don't, that's totally fine. So my background was in physiology. So I did my bachelor's in physiology. And one of the more common themes that I saw within physiology is how outside factors affected how our body worked. And one of the major components of that was actually nutrition, what we ate. How did that change our physiology? So once I started learning more about that, it was one of those things where it kind of felt natural to kind of just delve deeper and pursue another degree in nutrition. So I ended up getting my master's in nutrition, and then with that, becoming a registered dietitian.
How was the journey?
Oh, it was long, but it was definitely something that I enjoyed it. I think the thing with my particular journey was, even though I loved that I did physiology first, it would have maybe been easier if I did nutrition first and then did a master's in nutrition.
Yeah.
But they go so hand in hand together that it just kind of melted, you know?
Oh, okay.
Yeah.
So would you advise anybody who wants to be, let's say, a nutritionist as well, or again, dietitian? Would you advise them to like do both, or just go right into?
So you could really, I feel like you could really do anything. Mariana will kind of talk about her own experience, because her journey was a lot different from mine. But I feel like I've met so many people whose backgrounds are actually really different and outside of the science realm as well. And like, they wouldn't have changed it. It just gives them another perspective on how to even like talk to people, and, how they even look at nutrition as a whole. So I don't think I personally wouldn't have changed my own journey, but like, I think everyone has their own journey that kind of just fell into place. Yeah.
Okay. Yeah. Mariana, you want to top it up with your experience?
Oh boy. So well said. Yes. My journey was pretty different. I studied fine art in undergrad and got a degree in photography. And I wanted to be a professional artist or an art professor, both, whatever would pay the bills. And it turned out it was really hard to make money as a photographer and to have consistent income. And so I had a friend in undergrad that was studying to be a dietitian, and I thought it was really interesting, but I never thought I could hack it with the math and the science, because I was very much focused on art. And then, I don't know, things changed. I think I got really into cooking, and I grew up baking, and I thought about becoming like a baker or a chef or whatever. And I worked a lot of blue collar jobs as an artist, as you can imagine. Yeah, because I couldn't get steady work. And so I sort of worked in a lot of restaurants, and I was like put front of the house a lot. And then I started getting into baking, which was better because it was more, and then I was like, well, I guess maybe I could try to go back to school to become a dietitian. Like, I was always interested in nutrition, and I just started taking classes, but I was like working full time in the medical field, actually, at another place, just as like a receptionist or a patient service rep. And I was going to night school while working full time. And I just kept doing really well in the classes. And I was like, okay, we'll just keep this going. And I knew what school I wanted to go to. And I thought, well, I'll just try to get in there. And I did. And I completed my master's after piecing together all the prereqs, which was almost like a second bachelor's degree. And then, and then became a dietitian. I mean, there was more to it than that, but yeah, from fine art to the medical field.
So, hey, you know, if you're watching and you want to be a dietitian as well, you know, you heard their stories, you know, started from different backgrounds, but they are dietitians now, right? And so, was it difficult finding a job as a dietitian?
You know, I didn't. Okay, I guess I could go first, and then you can bring it home. After I finished my internship, because we have to go through like an unpaid internship for at least 10 months or like 1,200 hours. I studied for a few months to take the credential exam, and then I started applying for jobs, and I got one within like the first month. So I think I just hit it at a really good time. But I know other people, it took a lot longer to find like the job they wanted. And I'm still at the hospital that I originally got hired at. It's my first dietitian job, and I'm just going to ride it out as long as it makes sense for me. Yeah.
I mean, if you're staying somewhere, if you are deciding to stay somewhere for a while, I mean, that I see it as you find some comfort there as of now, right?
Yeah.
You're comfortable where you are right now.
Right. And challenged in the right ways. And it's like a good spot for me. So I'll stay there as long as I can.
Right,
My experience was a little different. So it took me a while to land my first job after graduating and passing the national RD exam, and then actually being able to practice as a dietitian. So I did a lot of all my internships actually in the state of California. So a lot of the times it's, from what I've seen, and a lot of people I've talked to, it's a lot easier to find a job when you have like your preceptor is there, or like you kind of like land a job at the place that you do your internship. But I was coming from a different state for that. So I came back to Seattle. I gave myself a month to study because I'm like, I just want to find a job. And it took me about 6 to 7 months, which is still like relatively okay compared to a lot of people, you know. But my first job actually wasn't in clinical nutrition. I was a food service manager for a little less than a year. That is a route a lot of people can take, but that was not the route I wanted to take. Yeah. I just needed a job. Wow. And eventually after that, I landed another on-call, like per diem position. And then I got another on-call per diem position. So I was working 2 per diems at once to be full-time.
2 different hospitals.
At 2 different hospitals.
Yes.
Oh, wow.
And then after that, I eventually was able to get like a part-time at one of the hospitals. And then I left and got a full-time position, which is my current position. So I've kind of throughout the years been jumping ships, but
so
finding like better ones.
Yeah, just kind of finding the place that I want to stay. Yeah. And like, but it's definitely been more of a journey because where I started definitely was not where I thought I was going to start, but I eventually ended up exactly where I wanted to end up. So it worked out.
It went out. So yeah, at the end of the day, I think, you know, always finding what you love to do and finding that sweet spot eventually is what we all look for, you know, that satisfaction in life where you go like, I think where I'm now, it might not be the best thing in the world, but I'm comfortable. I'm happy where I am. So yeah, I'm glad you guys have found a place that you like. And in terms of what you guys do now, are there different types or roles of, you know, of dietitian, right? For instance, I spoke to a case manager recently that was telling me about the inpatient and outpatient case managers, right? So in terms of dietitians, do you guys have something like that? And are there other roles that people don't usually know about that you guys play? You want to start?
Yeah, absolutely. I mean, not even just within our job, but there's 3 main categories that they train you for in grad school and in your internship. So there's food service, like Yasmin was talking about. There's clinical, which is what we're both currently doing. And then there's community nutrition.
Oh.
And so we get trained in that, and we take our credential exam in those like 3 areas. And also, I guess, like other like administration or there was some funky,
right.
Yeah. I can't remember the criteria or whatever the categories are. But anyway, so in the hospital, those are going to be the inpatient dietitians, and we do different things depending on the unit that we're on, but then there's outpatient dietitians too underneath the clinical umbrella. What am I missing for clinical? There's like home health dietitians that primarily do like nutrition support,
right?
Like tube feeds.
And that's where you'll see a lot where case management will be working. Social work and case management would be working with those dietitians to try to set them up with the home tube feeding. Yeah. In addition to like their medications, if they're going home with the PIC or like some central line that needs, I don't know, antibiotics or...
Yeah. So, you know, which, you know, draws it back into what we are talking about, you know, in terms of care, care coordination, and how, you know, I was talking to the case manager and she was telling me about how they work with nutrition, the social workers to set up, you know, home health, and you guys just, you know, also fit in there with your role in terms of, you know, setting up tube feeds and stuff like that, right?
Yeah. What's interesting about that though is that we'll write the orders for the tube feeds and for like parenteral nutrition if they need that outpatient, but then there are actual like home health dietitians that come in to do the teach. Like we don't even do that part of it.
Wow.
We just write our orders and then the social workers or case manager sends it off to home health, right? At the doctor.
Exactly. So what we write, it needs to be as accurate as what, like whatever they're going home with is what we're writing. So if there's any changes, that's not even the home health dietitian changing it. That's like our job to be able to
Keep them
update
up.
anything
Wow.
that needs to be updated in order for them to get home.
Sometimes, yeah.
And there's the decision to change diet is based on swallow evaluations, or just you have other assessments that you do to make that decision?
Well, that would be different. But so like for tube feeds, we would select the formula that we want the patient to have, depending on what they have going on and digestibility of things. But then in terms of like actual diet orders for eating, sometimes we will add restrictions or take them away, probably more often taking them away than adding them, actually, which might be surprising for people to learn about dietitians or trying to liberalize the diet.
Right.
But the doctors are often the ones that they order the diet order to begin with, and then we're allowed to manipulate it depending on which hospital. Are you allowed to change the diet orders on your own?
We have to talk to the
ask permission.
Yeah, ask permission, or kind of
privileges.
convince our doctors to be like, hey, could we please let them eat
and you
more?
have to tell them why, and I'll do that
Kind of
sometimes as a
justify.
courtesy, depending on what it is. It depends. Like if somebody's on a renal diet, but they don't need a potassium restriction anymore and they're not eating enough, I'll reach out to the nephrologist. And typically they're like, oh yeah, please do that. Please remove that restriction. So
Well, I mean, this is really cool to learn about, how all these different roles in healthcare integrate to, actually give patient care, right? And like I mentioned earlier, you guys' role are something that we don't really talk about a lot. I was saying you guys are in the shadows, right? You're doing your work, but nobody really sees what you're doing and stuff like that. Just because we don't really talk about you guys a lot, actually.
Right.
And you could see from how naive I was, even with the difference in the roles you guys play with it, So let me just ask the question as somebody who just is so naive and then ask this question, right? So if, let's say, a patient's on tube feeds and in the clinical setting, right? I see sometimes if we don't have it stocked on the unit, somebody brings it from the kitchen. Yes. Forgive me again. I always thought it was you guys that did brought it up.
So we're not dietary. Dietary is different than dietitians. Dietary is the kitchen staff.
Right. So we probably would just call the kitchen and be like, hey, they're out. Can you bring some more upstairs?
Or sometimes if it's like the ICU or something, for sure the dietitians, we have access to the kitchen. We go down there and we just
easily
to expedite things. But we don't deliver the tube.
No, not usually.
I can't imagine.
Well,
we don't do that.
We don't deliver most things.
Yeah, well, I'm sorry you have to deal with my ignorance.
You're all right. That's why we're talking. It's okay.
So that's really good to know. So, all right. So there are other roles, like you're saying, outside, like outpatient roles and stuff like that. As somebody trains as a dietitian, they can also work in other fields. Like, do you guys like something like a restaurant, or let's say I become a dietitian? What are some of the areas I could work?
I mean, some people work in like food service situations or like large corporations.
Yeah, corporate.
Those would be very lucky dietitians. I think those are coveted roles. I know there was someone that graduated from my university that worked for Kashi, like Kashi cereals and bars and stuff. Yeah. And I remember thinking that was so cool.
Every big major corporation, or majority of most food corporations, probably has a dietitian in the background.
Or they hire them.
Or they hire them.
Right?
You could even think of like McDonald's. They're going to have dietitians working with that corporation.
Yeah. I know somebody who's
McDonald's, and I only think about chef.
There's someone looking at the nutrition content.
The salad McShakers. Do they still do those at McDonald's? I don't even know. But like somebody I know, their mom is the dietitian that was like, we're going to do these now.
Oh, wow.
Yeah. It's pretty cool. That's like her legacy that she's going to leave behind.
You guys, I'm learning a lot from you guys. Like I said, we are on the units as nurses, and then we sometimes, we know we have dietitians, we know we have, again, I didn't know the difference. I thought I just grouped you guys with the same dietitians and then the dietary people from the kitchen. Like,
it's okay.
Yeah.
They fall under the within nutrition services. So I think a lot of people can confuse that, because we are a part of the nutrition services department. And that encompasses also food service.
So I'm one of the people who confused you guys a lot. And thanks for coming on the show to clarify this.
Yeah, of course.
And I'm sure this is beneficial to others who also don't know. So, and that's the goal of this channel, actually, to throw light on how, the roles that you guys, different departments play, and then how those all these roles support patient care, right? Like I was saying, you guys, people don't talk about you a lot, but what you do actually promote patient health, promote skin health, and all, and then healing actually in general. So, we really appreciate what you guys do, and and then I'm glad to be part of the people who want to talk about you guys and throw light on what you guys do. So I appreciate you guys. Well, in terms of care coordination, right? What would you say is the one thing you wish that the nursing team or other team, healthcare team that are not part of your team, what do you wish you could tell them to do that will make your work easier? Who wants to go first? What can we do to make your work easier?
Yeah, I feel like I think one of the bigger struggles, at least what I've seen, is just documenting anything that is nutrition related, like documenting like food intake. That is really helpful for us in every sense of the word. Just like in the flow sheets, rather
specific,
not
just percentages,
right?
Like it doesn't mean anything,
right? If you're able to do if you're able to get the percentage, I'll be happy. That's like I'll take that over nothing.
Because then you can at least have a guesstimate.
Well,
right?
I'm not sure if I understood you right. So that we usually you go to something like Epic will give you percentages, right? Did you say you prefer the percentages or you don't?
A percentage is fine, but if you say for, let's say 1,300 patient ate 50%. 50% could be of an applesauce or it could be of a burger.
Oh, okay.
So if I'm doing a calorie count, for instance, to get somebody off of tube feeds or see if they need them, or just in general, the doctors sometimes want a calorie count. It's hard for us to calculate and know exactly what a patient is eating or have an estimate for it.
Yeah, just a little bit more specifics would be
But percentages
helpful.
are good. Sometimes percentages aren't even there and you're well, how are you eating? And patients, it's very subjective. They don't remember they're sick in the hospital.
Right.
So any documentation.
Right? And then the other thing for me is just communication. Again, just regarding around nutrition. I don't need communication hey, you're going to I don't know, turn a patient, but just overall communication when it comes to the nutrition. So for example, if someone's on tube feeding, and there needs to be a change or maybe they're not tolerating it, instead of just completely turning it off.
Oh yeah.
Doesn't have to be nursing up. This is kind of generally speaking, to send us a message being hey, this patient's not tolerating. What would you recommend? Just consult us, because that's what we're here. We're a consulting service. So we want to make sure that the patient is getting the proper prescription. And at least if something's not working out, we'll come up with a plan B.
Yes.
That will hopefully work out. That would be probably a little bit more accurate than it's not kind of just throwing in numbers.
Yeah.
So,
well, I also played the devil advocate for nurses.
See.
So sometimes we are running around a lot. Maybe you have some patients that are
definitely
critical, and so just putting that percentage is a very quick
time.
Yeah, quick way of just percentage and I'm gone.
Yeah.
Right.
Rather than trying to write specific, right?
That's okay.
And
that's okay.
Sometimes they would ask you to write specifics. If we have that order there that documents specifically what the patient ate, then we take the time to do that. Other than that, most times we are just in a...
And that's okay, right? Because a lot of people, not a lot, but some of them are eating well. We don't need to know specifically what they're eating, but for calorie counts, right, it's really helpful to know.
Okay, yeah.
Or if you don't think they're eating well.
Yes, for patients who are not eating intake and...
it's just not as helpful specifically when documenting when there's just no documentation for 3, 4, 5 days. If even just one documentation,
just one meal.
One meal will give me an idea.
Hey, the patient how this ate for 5 days.
Right.
And maybe they haven't though, but it looks like that to us. We can look in the record though and see what they've ordered.
Right. We could
we don't know
we could check their calories.
But we don't know if the nurse ordered it or if the patient ordered it. Because nurses, you guys try to encourage them to eat, which we appreciate, right?
Right.
But,
Well, and then even you guys make a good point there, right? It's even if the patient ordered it, did they eat it?
Right.
Yeah.
Right.
A lot of it gets thrown away, right?
Yeah. So you might want to go off of the fact that they ordered, but you don't also know whether they ate it or not until we document whether how much they ate.
Yeah, I love just like when the nurses will do their chart, like once the shift or whatever, when they just say like ate well or you know, good appetite, you know, that gives me an idea that it's okay.
That's just
even
something about how they ate that day is like better than nothing.
Yeah, we don't need to know every single item unless it's a calorie count.
Yeah, you know, I always say if we understand things from you guys' perspective, it makes things easier for us to know.
For sure.
Like, what do I have to put in here that would make you guys' work a little easier for you, right?
And the main reasoning really behind it is just like, we're trying to figure out, does this patient need nutrition support via tube feeding, or if they can't, like, PN, or can we wean off their nutrition support? And so that's kind of like my mentality whenever I'm looking at a patient. Do they need this or do they not? Do I need to bother someone? Like, hey, place a feeding tube?
Well, okay. Thank you for bringing that up. As somebody who's also on the floor, like I said, understanding you guys' perspectives is very helpful. So now when I'm documenting, I'll be thinking about you guys. I'm like, okay, I got to write this down for them.
Well, you know, and if we order something, it's for a reason. It's not because we're trying to give you more work to do. We need it for something, right?
So, I think sometimes as a nurse, you are thinking the patient is eating fine. There are other things I'm worried about versus what they are eating. But again,
a lot of things.
But
100%.
But again, back to you guys' point, if I don't also document well, then you guys also don't really know whether the patient is eating well or not, right? So, so we'll do a better job.
We all work together. It's teamwork, right? Everybody's part is important, you know, to piece it all together. So,
and I think some part that I think nurses would also have to work fixing is when you have your PCTs or CNAs that you are working with, and sometimes you think they might have documented because maybe they fed the patient and took the tray out,
and they don't.
Later you realize they didn't document.
I know, and then we reach out and we're like an epic chat, like, oh, hey, this patient eating well? And they're like, I don't know. Check the documentation. It's like, oh, there isn't any. You know, because the CNA might pull the tray. Exactly. It's hard.
And I know at the hospital I work out, there's a lot of open dialogue with it. I actually met with the nurses, with a team of nurses, about documentation a few months ago, and kind of figuring out a solution how we can make this better. Like me and another dietitian and my boss kind of met up with everyone. So it's been a pretty open conversation with everyone. But you know, there's a lot of people involved with it. Not just one person is looking at this tray. So,
well, and is there anything else you guys think that we can do besides, you know, the documentation? What else? Is there anything else you can think about that you think nurses can do to make you guys' work easier for you?
I think just consult us. It's probably like controversial to bring up, but I think sometimes other caregivers might give nutrition advice that's not appropriate. And that's kind of hard when you go into a patient room and the patient's telling you what the nurse told them or what the doctor said, and it's not correct. Because, you know, how many nutrition classes did you take?
One.
Doctors typically as well, right? And so, you know, we've been studying this for years, and we continue to study it to maintain our credentials. And it's, you know, especially sometimes there's fad diets that get brought up with patients, and you're like, oh no, we're villainizing certain types of foods. Like I had a nurse tell a patient that saltines were poison, and she had had like diarrhea and vomiting for like 3 days prior to admit, and she just needed to eat something, and that was the only thing that she felt she could handle, and then didn't feel like she was able to eat those saltines. So I mean, that's pretty extreme.
Oh my goodness.
Right. So, you know, there's reasons that we want to eat certain types of food. And just because we think it's healthy, it might not be healthy for this person, especially if they're sick or whatever condition they're dealing with.
Well, I really like you guys are really giving me a lot of opening my eyes a lot into like again, we talk about care coordination. Sometimes we are thinking about only the benefit to the patient. But I think the benefit to the patient starts from the enhanced coordination between, you know, the care team.
Right. It's all about being interdisciplinary. So that open communication will give is the only way to give like the best type of care for a patient. So
symbiotic relationship,
right,
the best ones.
I think we have to start thinking more about, as nurses, like when you're documenting, like what I'm writing, how is it going to impact the care that the nutritionist or dietitian is going to provide.
It's all data collection, right?
Yeah.
You all have to record a lot of data. So it's hard.
So I think most times probably we think more of it like what information is going to relay to the doctor versus you guys. Like I said, you guys are in the background, so sometimes we just overlook you guys.
Yeah,
but you guys are
sneaky.
sneaky. You guys play a very important role in terms of care coordination, and I think it's about time that we pay more attention and work together with you guys so we can always improve patient health outcomes. So I really appreciate that. Your advice, if let's start two advice, right? So let's start from here. If I want to become a dietitian, what would be your best advice for anybody who, let's say somebody watching this show right now, they're contemplating which career to choose. They've thought of maybe dietitian, and what would be your advice?
Contact a dietitian. Just reach out. When I was in my undergrad studying physiology, what kind of led me to like really deciding like, okay, dietitian is the path is the career path I want to take, is I contacted a ton of dietitians. I just like free called them. I found them on the internet and just called them, be like, hey, I'm interested in this. Could I just talk to you just so I know what did you do to do this? And like, do you actually like your job? So, and there's like a lot, like Mariana had mentioned earlier, there's a lot of routes that you could take. So what I had done was I messaged, like private practice dietitians, outpatient, even an inpatient dietitian. Out of them, I was able to kind of get a better idea and a better understanding of what exactly they did and if that's something I wanted to do. And then here I am now. So it definitely helped kind of have a clearer, like for me to have a clearer mind of that this is what I eventually wanted to do.
It's always good to have that background information on, what you are getting yourself into.
Definitely.
Yeah. Even I know in nursing, we have, I've seen people who have got into nursing just because they thought it was a decent paying job. Yeah. And they realized what it takes.
Yes, it's a lot. Yeah, a lot.
And then run away. I've seen people who have left the field to do something else. I remember seeing a lot of people who break down and cry.
Yeah, it's a hard job.
Because you think about all these years you spent in school thinking, you're going to love your job, and you go like, I hate it so much.
Yeah, I think that can be common in the medical field, probably in a lot of professions, honestly. But
it's not easy being around people who are always sick. It's not
really hard.
An enjoyable thing to see every day. Yeah. But I think like for healthcare workers, you kind of create a tough skin after a while where you're like, I could still be empathetic, but like this won't affect me.
Yeah.
And it takes a while to get
to that point.
Yeah. Hopefully
sometimes you still will have a case where someone's really sick and
Yeah. And I also think sometimes the system itself, it's what makes their job challenging. The system is set up in a way that makes your job even harder for you, right? So, most of these organizations are money driven versus care driven.
Keep people sick.
People sick, and you as a nurse have to be in that dilemma of, I want to do the right thing. I know what the right thing is to do, but I don't have the resources.
Right.
Or
there's budget cuts happening.
Yes. And sometimes also some of the things also might go above even the organization. It's more, it's a systemic thing, and you are like stuck in there. Like you wish you could do more. You wish, but
healthcare in America.
Either you are limited by resources or you are limited by some laws and stuff like that.
Insurance coverage.
Insurance.
Yeah, we just have to do the best we can with what we have and hope that they're going to get better. Yeah.
And that's actually a thing that we also have to kind of think about with our care coordination for like tube feeding or our parental nutrition when they get discharged.
They afford it.
What is their insurance? Like what could they actually go home on?
Yeah.
And that's what home infusion has to deal with. Those dietitians have to look at their insurance insurance and be like, hey, like they'll reach out to us and be like, hey, so they can't
So
go home on
knowledgeable,
this.
yeah.
Their
Because
insurance won't cover this.
Yep.
Like you think of something,
change your
think
formula.
of a different formula or a different plan. They can't go home on a pump. They have to go home with it being syringed. Like you have to like think about these little things.
It's
Yeah.
just like medicine, like prescription drugs, right? Like certain insurance companies won't cover certain drugs.
Right.
And same with tube feeds.
Yeah, and I think that puts us in a very tight corner, right? For instance, like you're saying, you make as a dietitian, you know that maybe this tube feed or this type of tube feed will be helpful to this patient, but insurance will not cover it, so you have to look for alternatives.
Yeah, we can't get it.
And it's very sad, right?
Right.
So
Or they pay out of pocket.
Yeah, and it's expensive.
Not ideal.
Not ideal, but
Right.
it's very sad that we sometimes find ourselves in that situation.
Mhm.
But hopefully we will get to a better place where I always think like
someday.
like money shouldn't have been a question when it comes to providing care.
Mhm.
Money shouldn't even have been a question. I'm a proponent for getting all these pharmaceutical companies out of the stock market.
Yeah.
I think that makes them money driven rather than focus on patient keeping people healthy.
Yeah.
But however, anyways,
We don't need to get into politics. We can talk about that for a while.
So let's back to our nutrition topic.
Yeah.
So and so that and any other thing that comes in mind, or what would be besides your advice, what would be one thing that you say you give to any healthcare worker, right? That the one thing that you think is the most important thing they should think about when they are caring for patient in terms of the role you guys play, right? We're talking about care coordination, right? What would be one important thing that comes in mind that you think any healthcare worker should think about?
I think you kind of said it in the beginning in your introduction. I mean, we need food to live, we need nutrition to live, and we need adequate nutrition in order to heal. And so, I think nutrition is the foundation of health, and it's really important that we get what we need.
Yeah. And guess what I learned today? The difference between a dietitian and
a nutritionist.
Well, I learned that. I also learned how the importance of, documenting, accurately for you guys to make it easy for you guys to do your job. So I really, really appreciate you guys for coming today to explain that to us. So before we go, I don't know if you feel comfortable. What is one thing you will say to a nurse? Don't ever do this.
Don't ever. I think Marianne already said it. Don't give unsolicited nutrition advice.
Yes. Please. Consult your dietitian. We're happy to talk about nutrition with our patients. We have all the resources. Just please don't tell them to go keto.
No, please.
Don't make them afraid of food. Just, we got to eat.
Yeah. And I think that would be a little way beyond our scope too, right? Because you guys are trained professionals to do that. Like you said, we only have 1/4 of nutrition.
Right.
So we have some basic knowledge, but not in depth as you guys.
Right.
So I think that's a very good advice.
Right.
Noted.
Yeah.
Right.
Thank you very much. Appreciate it.
That's a very good advice. Yeah. So thank you guys for coming. We are coming to the end of today's episode. We appreciate Yasmin's journey into becoming the dietitian, and also your wonderful advice that you've provided us together with Marianne. You also have a very wonderful story and all the way here. And the advice you've given to people who want to become dietitians, I said. I'm getting used to the word now.
I mean, it's literally, like I said, it's in our credentials. It's very confusing.
Yeah. So now if I see RD in my note, I know it is registered dietitian.
Just dietary. Dietitian, not dietary.
It's not dietary, it's dietitian that wrote that. So thank you guys for coming.
Thank you.
I really appreciate it. And thank you guys for watching this episode. Again, I'm Nurse David, and I'll see you in the next episode. This is the DKA show. guys did amazing.
I hope
I
you did
really
so well.
appreciate, I really appreciate you guys' space. I feel so
Absolutely.
down with some of the things you
Oh, no.